Hello, I'm Bob Challoner, the President and CEO of Southampton Hospital, and I'd like to welcome you to another edition of Focus on Southampton Hospital, your monthly television program about the events and goings-on at your community hospital. Today we're going to have an episode to talk about wellness and the Ed and Phyllis Davis Wellness Institute here at Southampton Hospital, and I've invited to speak with us Dr. Alex Aponte, who is the Medical Director of our Wellness Institute. Dr. Aponte, welcome, and thank you for being on the show today.
Glad to be here.
Let's start off a little bit. Just tell me about yourself. I know you're a physician, family physician, but let's talk a little bit about your background and training, and I'm always interested in how'd you end up out here in Southampton Hospital?
Well, I was born and raised in North Massapequa, Long Island, and I had the misfortune of having my father obtain lung cancer from cigarette addiction, and he died at a young age, and it left a big impression on me as to how important preventing problems can be, and how impacting it is for the whole family, and what the trickle effect occurs. So young in life, I decided to be a physician. I went to Boston University and then SUNY at Buffalo Medical School. And I finished my family medicine residency at Overlook with a chief residency. It's with Columbia University. I was recruited from there to here. I had not wanted to really be in Queens or Brooklyn, and it was probably like either New Jersey, Westchester, or far out east. So in coming here, it's so beautiful. Every day is an appreciation of nature when we give ourselves the time to do it, and have been happy since.
Great. Well, we're very happy that you're out here. Now, you, for many years, were a busy family practitioner. You still maintain a large family practice, both out in West Hampton and here in Southampton. And I know that in addition to being board certified in family practice, you're board certified in anti-aging medicine. Tell us a little bit about that.
It's sort of an expansion, in a sense, of family medicine in real big emphasis on prevention. There's a couple of hallmark quotes. You're only as young as your oldest part.
That's a good quote to remember.
In seeing somebody, I try to evaluate what their needs are coming in the door, but try to forecast a month ahead, a year ahead, a decade ahead, as to use my experience to guide the person, not my way or the highway, but more along the lines of, you really got to get your blood pressure under control, or it'd be really great if we can get your weight under control, and to try to address the person's biggest risks.
And certainly prevention is a lot more effective ultimately than trying to fix problems after they've developed, and that many doctors are becoming advocates of more preventative approach. You were one of the pioneers here at Southampton Hospital. How did you get interested in the Wellness Institute here at Southampton?
I had a pretty significant patient following that was okay now, and pretty highly educated per se, and wanting to tweak their body in keeping the same way. So literally trying to head off issues a decade or two ahead of time, because heart disease starts a decade or two ahead of time, or strokes, Alzheimer's, all these things with not what the tricky part is it's not that hard to do. It's subtle changes, but people somehow sometimes don't give themselves a chance, that they say, I can't do that. And my dad taught me there ain't no can't.
No, good. That's
you have to try first.
So a patient that decides they want to go to see you, or a doctor who's board certified in anti-aging, or functional medicine's the other term, right? Maybe what is functional medicine?
The term functional medicine is to repair the problem at the source, and not prescribe a relief of symptoms.
Okay.
For instance, if you have insomnia, to give you a sleeping pill, not necessarily have stress relief and to try to work it in that manner.
Understand what's causing the insomnia to begin with.
If you have high blood pressure that's borderline, to change your diet and exercise first, then to use medications if that is inadequate.
Okay.
I'm also not so far away from medicine, and if somebody has asthma, I'm not going to not give them an inhaler and see if they have a pneumonia and they can't oxygenate their blood. I use all the traditional medications also, but I also, in my learning with the anti-aging program, I feel like I have more tools than a prescription pad or a scalpel for people's ailments.
Okay.
So there are many people that come in with an issue, and they're used to most doctors giving them a prescription or sending them for a procedure. And those things are very necessary.
Right.
If you have a collapsed lung, you need to have a chest tube, and it could save your life.
Right.
But sometimes it's not a prescription or a procedure, it's a exercise program. It's a getting out of a toxic relationship.
Right.
It's the sugar addiction that's so rampant.
Right.
So it's addressing those issues.
Do you find that you end up actually having to spend more time really just talking to the patient?
It's a lot more time in helping
Right.
them understand if we change paths somewhat away from what's, in my opinion, a dangerous path that the person's going down. If we can subtly improve a couple little things. My best teacher said, you can only use your experience to guide patients. They will tell you what's bothering them. They can tell you much more than you can as to what's wrong. And you need to just use your experience to help guide them. And that has rung true with everyone I see, in that the person is much more apt to accept the recommendation and follow through with it if they understand why I'm making the recommendation.
Right. So what are some of the simple things that people can do to actually stay well? I mean, that you would recommend?
It's not rocket science. The diet and exercise, without them, it's like missing a leg on a table.
Right.
You can't really establish that as a foundation.
Right.
Green vegetables, not having processed foods. Educate yourself pretty simply. There's a movie called Food Incorporated, and now Katie Couric did Fed Up with the sugar addictions in the US. That's going to be out on DVD September 14th. And the Phil and Ed Davis Wellness Institute has a whole host of things that would be something for anyone, because of all the different programs to just get started.
Do you find that with the aging baby boomer population, people really trying to maintain their health and their wellness, that's becoming more of a concern actually? And
that's really the age that the baby boomers are seeing their parents suffer through ailments. They're seeing themselves starting to have a couple little aches and pains, and putting one and one together. If I continue down this path, 5 years from now, 20 years from now, is there something I can do now so that's not me, as to what happened to my brother or father or sister or close friend?
Right. And do you think that there's some of the lifestyle issues, people probably don't just suddenly wake up and have an unhealthy lifestyle. It's probably additive, little things that they do and kind of go off course over the course of the path of their life. Is that your opinion on that? Or?
Well, that's usually how it goes. Sometimes what I'm trying to say is, though, that some of the changes aren't that, it's not like castor oil, it's not horrible.
Right.
So sometimes it's really subtle stuff.
Right.
Decreasing milk protein in somebody who's got asthma and inflammation and eczema,
Okay.
or eliminating it. Sometimes it's the sugar addiction with the artificial sweeteners that finally got proved to cause weight gain, to just eliminate artificial sweeteners, to just go for a walk instead of a different way to relax, quote unquote, with a bag of chips and a TV.
Right.
We have the functional fitness program that evolved from people coming to physical therapy, and their insurance only allowed them to have 4 visits or 6 visits. Right. And they're like, I love the people here, I love the machines, can't I just come back?
Right. Right.
And then we allowed them to join as a gym. But with functional fitness, it's a supervised introduction to exercise. And
I was going to ask, what is functional fitness?
It's with a physical therapist, yoga instructor, physical therapist assistant, yoga instructor, and the girls are so well liked and it's so well received. I usually just say, just go once and see if you like it. And almost always the people come back because it's not intimidating, it's not overwhelming. Right. It's not something to be embarrassed about. So, and it's very inexpensive.
And I know an advantage, some people are afraid that they, sometimes starting exercise, it hurts, and people may be worried, maybe I'm stressing my body too much or my heart or whatever, but having nurses available and doctors available probably gives some people confidence.
These are the same people that do cardiac and pulmonary rehab, so they're very well trained, ICU nurse, there's nurse practitioner, Jessica there. So they know you couldn't be in safer hands to try out getting moving again.
Exactly.
And God forbid something happened, you're in the perfect place for it. It's I use the analogy of like, I would much rather you have this stress test with the cardiologist standing right there than you to be, on a hike in Shelter Island, Shelter Island.
Totally isolated.
Totally
yeah,
isolated,
exactly.
where if something did happen, no one can, or you're just too far away to do anything about it. It's a controlled stress to get you stronger.
So what are some of your recommendations on some of the basics? Like, how often should I see my primary care provider? What would be your recommendation?
People who do see their primary care provider more often than less often have, I believe the statistic is when you go from 1 to 2 visits a year to 3 to 4 visits a year, your chances of hospitalization go down 3-fold, and your chances of mortality go down 2-fold.
Really?
So, most people I could see the doctor 3 times a year, every 4 months. Sometimes it's like pulling teeth, but other times it's like, I'd rather keep an eye on my cholesterol, my blood pressure, my weight. What else can I do to maintain my memory? All sorts of things. Everybody's different.
Do you find that part of your effort is the visits with patients, especially a little more frequently, is reinforcement of the basic message? Are people, I know myself, I can't even count the number of times I've said, okay, I'm going to eat a little bit less this week, or I'm going to make sure I get proper sleep, and I'll do it for 3 days and suddenly go right back to my old habits. So
that it's we're always in general our worst enemies, but reinforcing subtle changes. Sometimes my only leverage is like, if you're not going to do what I'm recommending, you're not following what I feel is going to keep you out of trouble, I can't be your doctor anymore.
Right.
And sometimes the relationship develops to the point where the person actually quits smoking.
Okay.
Because they want to keep me as their doctor. Sometimes it doesn't work.
Right.
There's been times where I saw somebody 10 years ago, they finally quit smoking, they came back and like, I'm back.
Sounds like you have to be a little bit of disciplinarian, is what some people need as well.
When it comes to very dangerous behavior like tobacco addiction, there's been stat after stat that if the doctor brings it up and the doctor keeps fighting, hitting it home, because it's a procedure code for smoking cessation.
Right.
And I got yelled at, why do you do that?
Right.
You have to stop doing it. I'm like, no.
Right.
Because your biggest risk of dying and stroke and heart attack is your tobacco.
Right.
We don't need to talk about your cholesterol, your blood pressure, and your anxiety, because that's what's going to hurt you.
Let's deal with the immediate problem.
I have to do my job, and because I know that that's what's going to take precedence. People don't really realize the tobacco and the sugar issues in this country are just so exponentially higher.
Right.
Like tobacco-related deaths are more than alcohol, prescription drugs, recreational drugs, alcohol-related motor vehicle accidents combined tenfold.
Wow.
So, there's no comparison.
Right.
So, things like Tutti Frutti flavored electronic cigarettes just make my skin crawl because
Right.
how many, 55-year-olds just love Tutti Frutti so much that
Right.
that's why they're going to take the electronic cigarette and not the regular cigarette.
Right, right.
Because it's being catered to kids.
No, I know, and certainly it's a challenge. How about nutrition? I know that one of the areas that you particular, I've heard you talk about this in nutrition, the importance of nutrition. And sugar clearly is an issue. What are some of the other things that you particularly look for in nutrition? And a lot of confusing advice about nutrition too. Every time you open the paper, they're recommending eat this, don't eat that, or eat, I remember in the days when we weren't supposed to eat meat and then we were supposed to eat pasta for a while was popular. Now it seems like it swung the other way. What advice do you have for people around nutrition?
I reference some other physicians' work. I'll often, Dr. Furman brought out Andy Score's aggregate nutritional density index. It's just how many nutrients are in the food per calorie versus how many grams of protein, fat, salt. It's how much nutrition there is because the brain needs to get signals. We're good on nutrients.
Right.
So when people will make a smoothie with, say, almond milk, a leaf of kale, a bunch of berries, some apples, put it in the NutriBullet, put it in a blender, drink it on the way to work, they're not that hungry 2-3 hours later because their brain got not a tremendous amount of calories, but a huge dose of nutrients.
Right.
The 500-pound man who has 2 chickens, a large fries, a Diet Coke, within 100 to 120 minutes, he's hungry again. Why? Because his body stored all the calories, did what it was told, and sent signals to his brain. Oh, and the gallon of milk.
Right.
Sent signals to his brain. We're hungry.
Right.
We're hungry for food.
Right.
But they're hungry for nutrients, not calories.
I see.
So it's that simple separation of, did I have greens today?
Right.
Count 3 greens every day.
Okay.
That's one of the things I try to
What
get
do you mean
patients.
count 3 greens? What's that?
Count 3 greens. I had a salad with lunch. I had asparagus, and I had some greens in my shake in the morning.
Right.
Or just try to get 3 green vegetables and try to get 5 to 7 colors in your foods every day. It's something that you can just do on your own.
Right.
When the only vegetable a teenager has had is a French fry, it's concerning.
Right. Yeah.
Because kids in particular have these cheese, pizza, chicken nuggets, and fries diets, and it's a real big setup for problems
later on
because they don't get out of that mode.
We just don't know how to prepare the other foods
Caloric
sometimes.
dense, nutrient deficient foods.
Okay. What is it about kale? I bought the NutriBullet. I'm putting it in my smoothie in the morning, but why is kale so great? What is it about? And the leafy green vegetables that we keep hearing about.
It's considered sort of the gold standard of nutrient density.
Okay.
It is just so, I was imagining in my mind, how can I take this smoothie and just put it in a pill?
Right.
And sell it and become very wealthy.
Right.
It hasn't been done yet, but we can try to dehydrate it and do so. There are companies that make like, Juice Plus that make these capsules, but there's no substitution for food.
For
a lot
real,
of times
food.
there's a lot of practitioners that have these weight loss programs with a meal substitution. You can't.
Yeah.
You need the micronutrients that we don't know what it is.
Okay.
You can't really package it.
So it's all the nutrients that's in the kale and the green vegetables that's important for you.
High amounts of electrolytes and vitamins. Vitamin K is in the green leafy vegetables, and all sorts of other fibers and digestive health and immune function and all those things.
In your practice, when you see patients actually make a concerted effort and make the switch from the French fries and chicken nuggets to, to lots of vegetables and fruit, what kinds of positive benefits do you see with patients?
They tell me generally. So they, you don't have to, exaggerate what you're doing or underplay, because they just feel better.
They do.
Their blood pressure comes down. Sometimes their blood work is shockingly better.
Right.
The diabetics that other doctors have said, you cannot control this on your own.
Right.
It's not going to happen, and where they do it, and they're very proud of themselves. I usually will print up a graph of their weight, and it comes down, and they can put it on the refrigerator to sort of motivate them,
Right.
Just to not grab the sugar, and little tricks like grabbing some vegetables in a Tupperware and munching on them throughout the day, and then finish it on the way home.
Right.
Walking in the door hungry is a real bad setup.
Right.
It doesn't matter who you are.
I know going to the supermarket hungry is a bad thing for me because I run right for the junk food. So,
so it's but you should be eating when you're hungry.
Right.
But it's planning those choices. Like we plan so much in our lives, but we rarely plan our meals, or at least
Right.
most people who are busy.
You think there's some validity to the lots of small meals concept also, or is that?
Somewhat, but if you're getting very nutrient-dense meals, like that smoothie in the morning, you're not very hungry in an hour or two.
Right.
But there is some validity to eat and burn,
Right.
to be burning off calories as much as you're eating them.
Okay. Lots of concern in our society about diabetes, and for years we just accepted the rising diabetes rates, and turns out a lot of it's certainly lifestyle related. And I know that one of the concerns, certainly with a physician such as yourself, is diabetes, and I've heard that people can be pre-diabetic. What does that mean exactly, and what should I start doing if I'm told I'm pre-diabetic?
I treat prediabetes as diabetes. I'm
Okay.
much more aggressive in that fashion. It takes a while for a person to sort of get on board, because it's very frustrating. The person can't eat in the way that they're eating, and especially the sugar. So it's addressing the overconsumption of sugar as an addiction. I had heard an addiction specialist speaking on sugar addictions, and he had said, if we have an alcoholic, we tell them don't drink alcohol. But
Right.
if you told an alcoholic to have one beer every 6 hours, they would think that you're crazy.
Right.
But what do we tell our diabetics and our sugar addicts? That you can't eat sugar at all?
Right.
That doesn't work, because
Right.
they have to eat something. So it's trying to address like how they got to that point. And when you're pre-diabetic, by definition, it's a blood test called a hemoglobin A1C. And when that is 5.9 to 6.4, the person is considered pre-diabetic.
Okay.
They are having high sugars at times. When it's 6.5, they're considered diabetic, and goal A1C for a true diabetic is 6.5.
Okay.
To get it down to the pre-diabetic range. And there's all sorts of medications, and there's newer insulins, and there's sugar blockers, there's medications to help you excrete sugar out of your kidney. There's a lot more available. However, the medications, though, delay disease onset. They just buy you time. So the more the person does to not be at that point where they need medication, the more time they buy themselves, and hence they delay the diseases associated with diabetes, which are blindness, kidney failure, requiring dialysis at times, heart attacks and strokes, and earlier dementia.
Okay.
So those are pretty serious
Yeah, they sure are.
endpoints.
Right.
So the government, ourselves, our electronic chart, are doing everything we can with the diabetics to, check off that this is addressed, that's addressed, the other's addressed. there hasn't been enough of a check off of, has the person attempted
Right.
to start exercising? Has the person attempted to start changing what they're eating?
Right.
And there's still a lot of misconceptions, because I still have diabetics that drink diet soda because it doesn't have sugar in it. But that's not okay for weight.
Right.
So you might be not having a sugar flux, but your
Your
weight
weight is
just
still-
went up 5 pounds in the past 3 months. You're not any healthier now than you were then.
Right.
And there are some diabetic medications that make you incredibly hungry, which Avandia was taken off the market because it caused increase in heart attacks, yet the sugar came down. I still have a problem with some of the diabetic meds that increase your appetite tremendously, because the person's not any healthier, even though their sugar is lower, but their blood pressure, their morale, everything is
Not good.
not as good.
And lifestyle, actually, I hear you can reverse the effects of diabetes with a rigorous lifestyle kind of change
Absolutely.
program.
It's just, if you're kind of on the fence or haven't seen the doctor forever because of the fear of it, it's better to go address it, get the information you need, and get the resources and the tools you need to not allow it to progress to the problems, because the problems are really bad.
I know we're just about out of time, but we have a growing elderly population, or senior population out here on the South Fork in particular. Any advice and any programs that might be of use for our seniors at the Wellness Institute, or any other programs that you think might be helpful for people?
Well, there's functional fitness. We have nutritionists. We have massage therapists. We have acupuncturists for aches and pains. I'm very much in hopes that we continue a balance and gait program,
Right.
where seniors aren't afraid to
walk.
to go to the grocery store, to walk, to keep themselves out of trouble, because when someone stops ambulating, things get bad quickly.
Right.
The Tai Chi is a wonderful way that if you're pretty good balance, but you just want to tighten things up, all the orthopedic surgeons, when the patients can do some Tai Chi after operations, they're very glad, because they know that that person isn't going to have too many problems.
Right.
Now, preoperatively, grip strength is a determinant of, how they'll do after an operation even.
Really
So
interesting.
strength is important.
And wouldn't you say it's never too late to start also?
If you're not dead yet,
Right. Keep at
for
it.
2 days, there's something we can do to help.
Absolutely. Well, Dr. Aponte, thank you so much, and thank you for taking the leadership role you have in terms of wellness and anti-aging and functional medicine here at Southampton. As I said, you were really the pioneer in our community, and I know we all value your advice and guidance in developing these programs.
Thank you for allowing me to grow.
Thank you. And I'd like to thank all of you for watching today. If you have any questions, or would like some follow-up, or would like to get in touch with us at our Wellness Institute, I know that the number will be shown for you. It's 726-8800. We have a great staff there that can point you in the direction of any of the programs that Dr. Aponte has talked to you about. If you need any help navigating the healthcare system or advice for future programs, please feel free to call my office at 631-726-8555. As always, I'd like to thank our friends at CTV for producing this show and airing it in our Southampton communities, and LTV for airing it in our East Hampton communities. Thank you for listening, everyone, and good health.